action.
Hi, I'm Stuart at some of these vets. One of the things we get asked about a lot, and a very common problem with horses, are problems causing inflammation in their feet, either abscesses or laminitis, or sometimes just bruising and sore feet. There's a couple of things that are useful to be able to check as an owner, so you can get an idea of what's going on. And those are feeling for digital pulses and feeling for heat around the hoof capsule. Now, it's important to just be careful and just be mindful of your own safety. Obviously, you are going to be low down near the horse's hooves, so have them held by somebody who knows how to hold them. And just make sure you're not putting yourself in a position where you could be at risk of getting kicked or knocked over. Obviously, as you can tell, this young lady is very calm and not worried about anything. So we're going to check for heat around the hoof capsule. The easiest place to feel that is around the front of the hoof, particularly around the top, around what's called the coronet band. And just gently feel that with your hand, and you can compare that to the other side as well and see if there's an increase in the heat. There are a couple of places you can check for digital pulses. Now, in most horses you won't be able to feel a digital pulse unless the foot is inflamed. Some horses do have a normally detectable digital pulse, so it's important to compare one side to the other. I find it easiest to check for a digital pulse at the back of the fetlock, so just right at the point of the joint, and I put my finger and thumb around either side and just slowly pull them backwards, and you can feel around about here, you can feel a little tube just under the skin just flick under your fingers. That's the neurovascular bundle. That's where the artery, the nerve and the vein are, and that's what you're aiming for. Once you've found that, just release the pressure so you're feeling very gently. And remember that a horse's pulse is very slow, usually somewhere between 30 and 40 beats per minute. So you should just be able to feel that just pulsing under your fingers. It's worth practicing, particularly worth practicing finding the neurovascular bundle, so that it's an easy thing to do if you ever need to.